I'm the Executive Officer for the Canadian Home Builders Association, Central Okanagan. Joining me today is my teammate Jess, who will be monitoring the chat and helping behind the scenes. So thank you for taking your time out of your lunch hour to join us for an important conversation about men's mental health. So whether you're here for yourself, a colleague, a friend, a partner, a family member, we just appreciate you being part of today's discussion. And we're really grateful to partner up with Heads Up Guys to bring this conversation forward today. So we are recording the presentation just so we can put it on our portal and share it publicly, but we will turn it off during the question period in case you want to ask any questions, and we won't have the recording on during that time, so you can feel free to ask anything you'd like. So without further ado, I will just pass it over to Joe from Heads Up Guys, and thank him for being here today, and let him introduce himself.
Wonderful. Thanks, Cassidy. Hi, everybody. I'm Joe Rockert, and I am the Community Engagement and Partnerships Guy at Heads Up Guys. I'm excited to be here today, and it is Men's Health Month in June. So this is a very relevant topic during Men's Health Month, and I'm glad everybody is here. A little housekeeping before I begin. I want to state right off the bat that I am not a doctor or a clinician. So when it comes to the Q&A, if you do ask a question that I feel deserves the answer of a clinician or a doctor, I'll actually write your question down and I will get that answered by a team member here at our office and get you the proper information if I can't answer that. Also, as just kind of Cassidy referred to, this presentation, yes, it's aimed at men, but it is also for all genders. And you can either take away something personally. Well, everything will be personal, but whether you use it yourself for your own personal growth or for a man in your life, it's here in this presentation. And I think everybody is going to walk away with some learnings today. So on that note, I'm going to get us started. So thank you, everybody, and let's begin the presentation. So what are we going to cover today? We're going to cover 4 areas. The first one is why we need to talk about men's health. The second is what gets in the way of men asking for help. Third is a resource that can actually help. That's Heads Up Guys. So I'm going to kind of walk you through our website. And the last section, which I find is the most compelling section, is how to show up. And that's building the practical skills to support men's mental health. All right. So the first thing we need to do is we need to recognize men's mental health as a public health priority. And why is that? Well, on a global scale, I'm going to give you these stats. Every year, we lose over 700,000 people to suicide, which is almost twice as many as homicide. More than 90% of those who take their own lives have been struggling with their mental health. Around 60% of those who die by suicide had major depression, often untreated, and untreated depression is a leading risk factor for suicide. Those are global stats. So what do Canadian stats look like? Well, in Canada, men account for 75 to 80% of deaths by suicide. Every single day, 8 men die by suicide in Canada. That's just over 3,000 men every year. And suicide is the second leading cause of death for men under the age of 50. And I want you guys to remember that stat because I'm going to come back to that stat in the Q&A. And thoughts of suicide are common among men. In 2019, just over 1.6 million Canadian men over the age of 15, roughly 9% of the male population, reported that they have seriously contemplated suicide in their lifetime. And so we also too, we think that we've made great inroads in mental health, and we have. The conversation is changing, but these are headlines around the world, all within the last 5 years. And what these headlines show is that we still need a lot more work done. So from Canada and the CBC, alarming numbers around men's mental health indicate the need for a national response. From Australia, the epidemic of male suicide in Australia is currently higher than it's ever been. In the US suicide death rate is rising again. And in England, Wales, suicide rates in English and Wales reach their highest level since 1999. So that's kind of a quick global perspective and a quick Canadian's perspective on why this is an important issue. So now I want to dive into understanding the key symptoms and stressors that affect men's mental health. So what are the common stressors for men? What's weighing men down the most? From our research, these are the biggest stressors guys face. 1, lack of meaning and purpose, greater than 60%. 2, loneliness, greater than 50%. 3, financial strain. 4, relationship difficulties. 5, work-related difficulties. And other major stressors for men can include fatherhood and parental pressures, sexual health and dysfunction, bullying, overlapping health issues, and I'm going to just say queer specific concerns. So mental health in men, everybody deals with challenges, but guys often show their struggles in different ways, sometimes in ways that people don't recognize. So these are the more common or typical symptoms of depression that we recognize in people: feeling down, depressed, or hopeless, feeling bad about yourself, that you're a failure, have let yourself or your family down, or feeling tired or having little or no energy. Research has found, though, that men don't always show depression in ways that we expect. Some men also experience other symptoms that can mask the more common or traditional symptoms of depression. We call these early onset symptoms, which often go unnoticed and unaddressed, and they include anger, irritability, and aggression, reckless behavior, and substance use. Those are both bolded because I'm going to visit those in a little greater detail. Physical pain, low libido or erectile dysfunction, escapism and avoidance, withdrawal and isolation, and issues with sleep. So a little deeper dive into anger, irritability, and aggression. And this is a quote we received from Michael. I was finding things to get angry at just because it felt good to be angry, and that wasn't working. So for some guys, depression looks like losing our sense of humor, lashing out, short temper, frequent road rage, becoming more sensitive to criticism, being controlling, and being verbally or physically abusive to others. It might feel like anger, but there's usually something deeper going on. And a little dive into reckless behavior and substance use. And this is from a quote from Trevor that we received. For a short time, substances buried my problems, and then they got worse, so much worse. So engaging in escapist or numbing or risking behavior, often in an attempt to feel something or nothing, or because they can no longer care about their safety. And this can include pursuing dangerous sports, especially while disregarding safety precautions, driving recklessly, engaging in unsafe sex, abusing alcohol or other drugs, which increases the risk for suicide, and compulsive gambling. So signs and symptoms, and just kind of review this, and I'm going to categorize them here, is broadly, signs of distress can be grouped into 6 categories. We're looking for changes in behavior. We're looking at cognitive signs. We're looking at changes in mood or attitude. We're looking for physical signs. We're looking for changes in social life, and we're looking for subtle communication clues. So those are the symptoms and the stressors, and now I'm going to take a little slightly deeper dive into the barrier. So what's preventing men from seeking help? Men often hide their struggles, and many individuals, especially men, may not feel comfortable talking about their emotions or admitting that they're having a hard time. They may fear being judged or seen as weak, not recognize that they are struggling, not have the words to describe what's going on. They're unsure on how to ask for help, and they worry about being a burden to others. So the barriers to seeking help and why guys don't ask for help, a lot of it comes down to stigma and shame and not knowing where to start. So if you look at the circle, we have this low help-seeking behavior in the middle, and we have 4 things that surround it: stigma and shame, which are so prominent in why men don't reach out. But there's also a limited mental health knowledge. Guys are not introduced to health until the very late stages, or usually past puberty. So they have a very limited mental health knowledge. And guys also aren't great at articulating and asking for support in regards to mental health. Often they don't have the vocabulary to understand actually what's going on. So expressing it even becomes a little more difficult. So I want to dive into shame and stigma a little bit. So being shamed by their peers as well as parents is how boys are taught to conform to male gender norms. And we call this masculine socialization. That's society's teachings about how to be a man, the norms around what men can and can't do. So this is what we're taught: be independent and self-reliant, be strong and tough, always be in control of your emotions, never feel overwhelmed, don't show any emotions, don't reveal any vulnerabilities, don't rely on others, and don't ask for help. So I just want to take a little aside here for a brief moment and give you an example of masculine socialization, because it happens in our society all the time. And if you're not attuned to it, it impacts you. So the example I'm going to use, and I'm not sure if anybody has seen the Star Wars series Andor, but there's a lead character in that series, and his name is Cassian. And there's an ending of an episode where Cassian's in a spaceship, and he's flying away from a planet. It's the planet that he used to live on. And there's just been a big battle on the planet. He's lost his best friend. He's lost his family. He's lost his community. And he's lost his planet. And he's flying the spaceship. Camera's focused in on him. He's got a stern face. There's no emotion in it. Over one shoulder, there's a female on the spaceship crying. Over the other shoulder, there's an alien crying. What that image does of Cassian with that stern face is it shows every little boy or every guy that's watching that series that if you lose your family, if you lose your best friend, if you lose your community, if you lose your planet, you can't show any emotions and you can't cry. And that's an example of masculine socialization. So little digression there, but an example I wanted to share. So self-reliance and suicide they're tied so closely together. So men who are overly self-reliant are those who believe they should be strong in the face of adversity and consider that feeling down is a sign of weakness and are less likely to reach out to friends, family, or professional sources for help. One study of nearly 14,000 men found that being self-reliant, an element of dominant masculinity, stood out as a risk factor for suicidal thinking. So these are things around self-reliance. It bothers me when I have to ask for help. I never ask for help, and I need to solve my own problems. So again, I'm going to take a little aside here. When we talk about masculinity, and I think everybody has probably heard the expression toxic masculinity, we don't like that expression. We don't use it. It's a horrible expression in this field. Masculinity in itself is fine. Masculinity is great. It's when you take elements of masculinity and you take them to the extreme, and self-reliance is one. That's when it can become a mental health issue. So masculinity, like I said, is fine, but you have to be aware of when you've taken it too far and some of those things. So self-reliance, holding in your emotions, all those kind of things are part of that. So you just want to make sure you don't take it to the nth degree, so to speak. So that's kind of the symptoms and the stressors. That's the barriers. And now I'm going to quickly walk you through Heads Up Guys as a resource. So what is Heads Up Guys? Men's mental health is serious, but many guys struggle in silence. And that's why we created Heads Up Guys, a free, anonymous, and research-backed resource to help men get the support they need. We're targeting warning signs and risk factors for suicide in men, which is depression, low mental health literacy, high levels of self-stigma, and low help seeking. Heads Up Guys emphasizes recovery is possible, you're not alone, and better starts here. And Heads Up Guys launched in 2015 to fill this gap. Another quick little digression here. We actually started before 2015 as part of a research project. And Dr. Agranachuk, who's our founder, was part of the project. And they were in a doctor's office where men were visiting a GP. And they were filling out a survey. And one of the questions on the survey said, are you currently experiencing daily thoughts of suicidal ideation? 20% of the men said yes to that question, yet not one of those men brought it up with the doctor that they were about to see. And that's an example of shame and stigma being so entrenched and such a barrier that in the one place that you should be able to have a conversation about your mental health with your doctor, guys weren't having it. Again, another reason why Heads Up Guys was created. So this is our homepage. I'll dive into our impact. So we've had over 6.5 million visitors since we launched. We roughly average about 600,000 people a year visiting our site to use our resources. We've had over 900,000 people use our screening tools and checks. We've had over 30,000 people make connections to therapists, and we have a number of courses, and we've had over 2,500 course completions. We've also been featured in over 100 media articles across CBC, global, and actually around the world. And we're also on over 100 health and related websites listing us as a valuable resource. Heads Up Guys is a very unique resource in the men's mental health field. And there's very few, there's actually nobody like us in the field, and in this field. So because of that, we are a very valuable resource to those people in the field that need a resource like us. We are a global resource. We have over 100 self-care articles. We have over 100 recovery stories. We have self-guided courses. We have over 30 plus articles on how to support a man. We have an international therapist directory with now actually over 1,600 qualified therapists. And we are a research-based organization, and we have 80 plus research articles. So I kind of want to take you through a couple of sections on the website very, very quickly here. So the first upper left-hand corner is our screening tools, and we have a number of these, and this is just an example of 4. We have a depression check, which has been used, like I said, over 900,000 times. And both fortunately and unfortunately, when guys are taking the depression check, we're scoring. Our research shows that over 60% of guys are scoring yes for probable depression. So that's both a great thing and a bad thing, because yes, that's a very high score for a percentage, but it also gives guys a starting point, and that's important because they're on our website, and if you're scoring like that, we can then guide you through a path to get better. We have the male depression risk scale, we have a stress test, we have an anger check. That's just 4 of those. The You Are Not Alone section down at the bottom there, that's our story section, and that's probably one of the most compelling sections on our website for guys. The story section is stories about guys who've had mental health issues and challenges and overcome them. And often when guys find this section, what they realize is they're not alone. They're looking at stories from guys that are like, wow, somebody else has gone through this, because guys often feel they're the only person going through this, and they're not. So really a great, compelling section. And then how to help somebody with depression, that's in our friends and family section. So if you have a man in your life, father, uncle, brother, work colleague, doesn't matter. If you suspect that there's something going on, we have resources there that can help you with tools to understand them better and have an engaging conversation with them. So these are testimonials that we receive from people on a regular basis. I read your article on managing suicidal thoughts. Thank you. I'm pretty sure it saved my life. Heads Up Guys made me feel that I wasn't on my own and helped me understand actions I can take to help my well-being. My self-check score indicated that maybe it's time to stop lying to myself and pretending I'm okay. I'm going to reach out. I found this website during a very dark period of my life, and it gave me so much hope. All the resources before this were really general, but Heads Up Guys helped me feel more connected. We also do our own research, so we have to understand that the work we're doing is making an impact. So from our research, 74% of participants reported that visiting Heads Up Guys helped them better recognize symptoms of depression. 68% of participants reported that visiting Heads Up Guys helped reduce their sense of stigma about depression in men. And 70% of participants reported that visiting Heads Up Guys inspired them to take action towards recovery. These are great percentages from a research standpoint. So the last section, which we're going to go through, is how to show up. And this is building the practical skills to support men's mental health. So this is really, how do you have a conversation about men's mental health? So we've kind of gone through, know the signs to recognize, traditional and men specific, know the barriers to address, stigma and shame, and now how to start a conversation. So before you start the conversation, starting a conversation is about being present, caring, and open to hearing somebody else's story. When a man we care about is struggling with his mental health, it's natural to want to help, but it can be hard to know what to say or do. You are not expected to be his doctor or therapist. Your support, though, can make a real difference. This is where mental health conversations come in. You can be a steady, understanding presence in someone's life simply by showing up and listening. This is not about replacing professional help, but complementing it. Having a conversation also doesn't require us to have had the same mental health experiences as the person we are trying to support. What matters most is our ability to show up with empathy, presence, and curiosity. We don't have to fix anything or have all the answers. Before you start the conversation, a man is more likely to seek support if, and this comes from friends and family, recognizes his problem is common, sees the problem as out of character, believes that he can return the favor, believes that others will be supportive of his actions, and equates asking for help with taking control. So from a professional side of the equation, believes that professional support helps in recovery, knows how to access professional help, and has family or friends who have sought help before. You have to have realistic expectations. So when a man we care about is struggling with depression, our instinct is to help, but it's important to have realistic expectations. Our role as a supporter is to encourage him to seek professional help, provide emotional support without trying to diagnose or act as his therapist. We also need to temper our own expectations. This may be the first time he's discussing these feelings. He may be unfamiliar, uncomfortable with talking about emotions, and many men struggle with vulnerability. So be patient as he opens up. And I want to dive in a little deeper there. It's if this is the first conversation that a guy is having, he's had these thoughts in his head, but he's never verbalized them. So when you haven't verbalized the things that are going on in your head that are very negative, and somebody's asking you to talk about them for the first time, you might not have the words. You have the words, but you don't know how to get them out. So often, if you're having a conversation like this, there will be pauses in the conversation. Don't fill those pauses. That's just the guy trying to get the words out of his head and put them in a sentence or in a way that makes sense because he's never done it before. You have to show him you care. So our goal is to listen and let him know that you're there for him. To what level depends on your relationship. A work colleague versus a family member is going to make a big difference. As the conversation develops, you can point him towards appropriate resources or encourage him making use of different services. You need to pick an appropriate place and time. Try and talk in person whenever possible. Pick a place that is quiet, calm, and private. Make sure you have at least 30 minutes set aside for the conversation. Try to ensure there won't be any interruptions. And consider going for a walk or a drive so you can talk without being face to face, as this can help keep things less intense or intimidating for him. You need to create a safe space. So it's important we create a safe space for him to share what's on his mind. When approaching the conversation, we want to focus on being empathetic. Put yourself in his shoes to better understand the situation. Be approachable and non-judgmental. Don't make judgments or try to analyze or fix his situation. And you must be willing to listen. Ask open-ending questions and be patient. Try not to interrupt or rush him, and give him the space to speak and guide the conversation. As I mentioned before, a pause or silence in the conversation is okay. It's also really important to ask open-ended questions, because when you're having a conversation like this, if you ask a question was, how was your day? He can answer with a single word: good, bad, done, fine. So you need to say, hey, what went on in your day? What was your challenge today? What was your challenge today? Ask him something where he has to give more than a one-word answer. And it takes practice to ask open-ended questions. So in starting the conversation, it's important to let him know the warning signs you've noticed. Let him know you're asking because you care about him. Let him know you're available to talk or help out at any time in the future, again, if applicable to your relationship. Let him know that you won't judge him or make light of things. So what can you say? Here's some examples. You haven't seemed like yourself in the last few weeks. Is anything up? Maybe something I could help you with. I notice you seem pretty stressed lately. What's new in your life? I feel as though you seem pretty tired these days. What's been wearing you down? I know you've been dealing with a lot lately, and I'm honestly pretty concerned about you. Can you tell me how you've been feeling? So there's one thing about each one of those questions, is that they're all open-ended questions. You have to let them know you care. I know it's obvious, but you have to let them know you care. So it's important to be empathetic, open-minded, and non-judgmental in your conversation. For a lot of guys, it's hard to open up to another person. So it's key to let him know that you're open to whatever he has to say. Again, examples of what you can say. Don't worry, I'm not here to judge. Let me know what's on your mind. No matter what's bothering you, I'm all ears. I just want you to know that I have your back, and I'm here to support you in whatever way I can. You have to normalize his experiences. Though mental health and depression is discussed more these days, it's still often taboo for men. Let's show that talking about it is okay. So again, examples of what you can say. What you're going through is tough, but a lot of men deal with this. It's nothing to be ashamed of. I've read about athletes like Dwayne Johnson and Michael Phelps who face depression. It's more common than we think. It's okay to feel this way. Depression is real, and you're not alone. You must be hopeful and positive. Depression can create feelings of hopelessness, making recovery seem out of reach. Again, examples of what you can say. Remember, recovery is possible. This feeling doesn't define your future. It takes courage to share your struggles. You should be proud of taking that step. You don't have to suffer alone. People care about you, and there are effective treatments that can help. Things maybe take time, but I'm here with you all the way. You are not alone in this. Ask him how you can help. So again, depending on your relationship and the things he's mentioned he's struggling with, there may be things you can lend a hand with. For example, if he's struggling to keep up with daily tasks, offer to bring him a meal or take him out to eat. If he's having a hard time getting any physical activity in, ask to meet up for a walk. If he's too tired to plan something, do the planning and ask him just to focus on showing up. Point him to Heads Up Guys. So pointing a guy that you're concerned about to our site could be the turning point in his recovery. Show him the site directly or send him a link. Again, examples of what you can say. Maybe you could do one of those online screenings for depression. Here, I'll send you the link to try out. There's actually a really great website aimed specifically at men talking about depression and mental health. It's called HeadsUpGuys.org, and I think it may be helpful to look over. Encourage him to consult a professional. Seeking a health professional is a critical step, and there's two main options. Visiting your family doctor for initial evaluation and potential referrals, finding a therapist to explore and address deeper issues. We know that lots of people don't have a family doctor, and finding a therapist is incredibly difficult if you don't know where to go. And that is one of the reasons we founded our therapist directory. We've done the work there for people. So every therapist in our therapist directory has a men's health focus. We put them through our own screenings. So they are accredited people in men's mental health. So it takes away that barrier of not being able to find a therapist. We have it on our website for you. So again, what can you say in regards to this stuff? I hate seeing you down. There's no shame in seeing a doctor or a therapist. I can give you a ride or come with you if that helps. You've got nothing to lose by getting checked out. Best case, you get a plan to start feeling better. Do you have a family doctor? If not, there's a clinic where you could go make an appointment. You have to follow up. So supporting a person who is struggling with depression may be intuitive for some people, but for most, it's new territory. Knowing how to offer helpful support in a manageable way is critical, not only for the person we're supporting, but also for ourselves. So let them know you're available, be receptive to requests for support, ask him how you can help, provide support with specific tasks, ask for his help on tasks not requiring a ton of energy, check in regularly, respect his boundaries, be patient and hopeful, encourage professional support, and take any references to suicide or escaping from life seriously. So references to suicide. As I said, take any references to suicide or escaping from life very seriously. Many guys fighting depression will have suicidal thoughts. Any kind of reference to suicide, even if done in a joking manner, should be taken seriously. So for help with understanding and addressing suicide risk, we have a section on our website called Managing Suicide Risk. If that risk is immediate and apparent, Crisis Service Canada at 988. It's available 24/7, and it is your resource for situations like this. So you have to take care of yourself. So, and this is on the personal side of the equation. Reach out to a close confidant if you're struggling. Touch base with your EPA provider if you have one. Check in with your family doctor. Contact a therapist. And if you are struggling and you need immediate help, again, Crisis Service Canada at 988 is your resource to call. So that's a quick overview of men's mental health. And I just want to recap what we talked about. We talked about why we need to talk about men's mental health, and that's both the global and the Canadian statistics showing the impact of suicide and depression. We talked about what gets in the way of men asking for help. That's shame and the stigma. We talked about Heads Up Guys, the resource, and we kind of quickly went over resources. And we did a quick overview on building the practical skills on how to show up. So now we'll take questions and answers from everybody.